Hello, today's video topic is acute pancreatitis. Pancreatitis is something like, inflammation of the pancreas. Suppose you have a tonsillitis, we have a pharyngitis. The same way, the pancreas is inflamed. So, but the only thing is, it's actually an emergency condition. It's a very a little serious condition. It needs an immediate and emergency treatment for the patient. See, the pancreas, everybody knows, is in the abdomen. The main thing about the pancreas is it almost touches all the organs. You are either your stomach, your small intestine, ileum, colon, kidneys, your spleen, your diaphragm, everything it touches. So when it gets inflamed, when it gets the pancreatitis, it can affect other structures. To simply understand pancreatitis, we can say this is something like a volcano erupting. When a volcano erupts, it the same way, when the pancreatic juice, instead of coming through the duct to enter the small intestine, it seeps outside. It's like a erupting volcano. So this fluid, when it comes down out, it can affect the other organs. That is why, moreover, this fluid seeping out of the pancreas not only have the local effect, but also have a systemic effect. So the treatment should be immediate and it should be very serious. What are the causes? What really causes this pancreatitis? Generally, alcohol. Alcohol in any form and any quantity can cause pancreatitis. This is the first and foremost. The second is gallstone. Suppose somebody has a gallstone. We call that gallstone pancreatitis. And the stone comes down, it goes and blocks the pancreatic duct and can cause. So alcohol, pancreatic gallstones. Third is viral infections, like suppose viral hepatitis or even Coxsackie virus that affects the pancreas, they can cause. Then we have certain medications like gliptins, given for the diabetes. These gliptins can cause. And metabolic things. If you have a high cholesterol, especially the triglycerides, when you have a high elevated triglycerides, these can cause pancreatitis. And the first, this is what are the complications? What can happen? Suppose somebody has a pancreatitis. Usually they present with pain. The pain could be mild and it could be for some time and can automatically dissolve. But for some other people, it will be very severe and very serious. The pain is so excruciating. It will be mostly the upper part of the stomach, and it can go back to the back. It's something like a stabbing pain, piercing pain from front to back. Even the slightest movements they cannot do. They cannot breathe because that is where the pancreas is there. So any movement, the spine, the pancreas is touching the spine also. So they cannot. They lie still. They won't even breathe that easily. So this is a condition they will come. And what is the treatment? How to diagnose first? Of course, with a history. Usually they will have a kind of alcohol or even other histories, or even they have a previous acute pancreatitis. Then the gastroenterologist will ask for other blood tests, especially amylase, lipase, calcium level, all these things. And the confirmation is done by mainly with the CT abdomen. The CT abdomen will show how the pancreas, what's happened to the pancreas, and more or sometimes MRI will be done to look for what are the other reasons for pancreatitis. So these are the tests. Then once the diagnosis is confirmed and the patient needs hospitalization, what are the complications we can expect from pancreatitis? Generally, acute pancreatitis, they can go for electrolytes imbalance, low calcium level. This pancreatitis, when they start eroding the other areas, they can cause necrosis of the pancreas. That means the pancreatic juice will eat its own tissues, making the tissues necrosed. So it's a necrotic pancreatitis can happen, or sometimes abscess can form. Sometimes hemorrhagic pancreatitis is called. When it erodes, it can erode the neighboring blood vessels, causing severe bleeding, which is uncontrollable. And because it's eroding the other areas, it can perforate the other organs like intestines. When it's eroding, it can even irritate your lungs. So fluid can collect in the lung, base of the lung, especially on the left side. So these are the complications, and electrolytes and imbalance. These can happen. Suppose the treatment is okay with the medical treatment, fine. But most of the times it may very rarely it may require a surgical. Suppose abscess, necrotic infection, or hemorrhagic pancreatitis comes, you need surgical intervention. So these are the reasons. Pancreatitis can happen to anyone. Even there is a study saying people in Kerala, they have a tapioca. They have a staple diet. Those who are taking nowadays not there, but those who are taking tapioca too much, they can get pancreatitis. When a pancreatitis comes, it needs proper management, and lifelong they should be little more careful about their diet and any triggering factors. But you don't have to worry, or even you don't have to fear about the pancreatitis. Suppose you triggering factor is cut down. Suppose alcohol is the reason, and you put alcohol, everything becomes normal. And if gallstone is the reason, once you remove the gallbladder, pancreatitis cannot come. If drug is the reason, if it is stopped, most of the time it won't come. But there is a segment of people, a hereditary pancreatitis, where children are affected. They are the one who will have a long-term problems leading into chronic pancreatitis. So acute pancreatitis is something like an emergency or serious condition which needs immediate treatment and proper guidance from a gastroenterologist. Thank you.